Modified Case-Jordan diagram. It is a simplified description of dental caries, which is the result of interaction of oral flora in the biofilm with the fermentable carbohydrate like sugar in our diet on the tooth surface, which is host over time. Means the bacteria in the biofilm will interact with the fermentable carbohydrate like sugar in our diet on the tooth surface, which is our host, and will produce acid. This acid will decrease the pH below critical point. The critical pH is 5.5. If the pH stays below 5.5 for long duration of time, it will produce dental caries by dissolution of minerals from the tooth surface. There are primary and secondary modifying factors which will play a role in dental caries. These are primary factors. First is tooth anatomy. If there are deep pit and fissure, it will create hub for the oral flora to grow and will produce dental caries. Saliva. If there is hyposalivation, the bacteria or oral debris will not be able to flush out, which will produce dental caries. If the pH of the biofilm is below 5.5 for long duration, which will produce unacidic environment, which will also result in dental caries. So, and use of fluorides is necessary for the prevention of dental caries. Diet specific. If the person is on high carb diet, means more of sugar, it will produce dental caries. A good oral hygiene is important to prevent dental caries. If the immune system is not strong, the oral bacteria will grow, which will result in dental caries. If there is any specific genetic factor such as immunocompromised disease or deficiency disease, which will result in low calcium and phosphorus level, which will aid in dental caries. In secondary modifying factors, the socioeconomic status. If the socioeconomic status is not good, the patient may or may not be able to maintain a proper oral hygiene routine. If there is no education on oral hygiene routine, then there will be more caries, dental caries seen. If the lifestyle is too basic or too stagnant, which will also adds up in modifying factors. If the environment is too acidic or the external environment. Age also plays an important role in dental caries. With age, the collagen and vitality start to decrease, which will result in dental caries. The occupation. There are many diseases which are related to the occupation of the patient. This is demineralization and remineralization cycle of dental caries. If the biofilm pH drops below 5.5, it will result in demineralization. If it is above 5.5, means it is alkaline in nature, it will result in remineralization. Below 5.5 pH, there is loss of minerals like calcium and phosphorus, which will result in dissolution of the tooth structure. Above 5.5 pH, there is restoration of this calcium and phosphorus levels, which result in remineralization of tooth structure. There are pathologic and protective factors. Pathologic factor favors demineralization and protective factors favors remineralization. If there is acidic environment, it will result in lower pH levels, which will result in dissolution of tooth structure. If there is poor oral hygiene, it will result in production of biofilm, which will result in demineralization. If the diet is on high carb diet, which will produce acid and which will eventually form dental caries. If the dental anatomy favors localization of food debris and bacteria, it will result in dental caries. If the salivary flow is low, if the saliva is thick and it is less in quantity, both the quantity and the quality both matters in salivary flow, it will result in dental caries, because the flushing out of action will get blocked. If there is repeated exposure to sugar per day, it will also result in demineralization. Now the protective factors. Alkaline environment favors remineralization when the pH is above 5.5. If the oral hygiene is good, means there is less number of bacteria and biofilm, which will prevent dental caries. If the patient has low carb diet, It will also helps in prevention of dental caries. If the salivary flow is high, there will be more flushing action of food debris and bacteria, which will prevent dental caries. If there is less number of exposure to sugar per day, if a patient has intake of sugar 1 or 2 times a day, there will be less number of chances to have dental caries. If the person has repeated exposure, it will increase the chances of having dental caries. If the person use fluorides and other chemotactic agents, which will also prevent dental caries. It all depends on the levels of calcium and phosphorus on your tooth structure. If the pH drops below to 5.5, then there will be loss of minerals. If it is above 5.5, there will be restoration of these levels, which will aid in prevention of dental caries. So this is all about the demineralization and remineralization cycle. If there is repeated number of demineralization in the person's life, then it will result in tooth decay, formation of dental cavity. This is Stephan curve. It shows us the relationship of time and the pH of dental plaque after the exposure of carbohydrate, which is glucose rinse. It is the graphical representation of how the pH level of mouth, that is dental plaque, after consumption of carbohydrate will make teeth more prone to demineralization. The key point here to remember is the critical pH, which is 5.5. If the pH level drops below 5.5, the enamel starts demineralization. If the pH of the dental plaque does not fall below 5.5, there will be no demineralization. This shows us how the pH change can indicate risk of dental caries. Suppose when the patient rinses with glucose, there will be initial drop of pH. If the pH does not fall below 5.5, there will be no demineralization, means the patient will be caries free. If the initial drop is below 5.5 but for shorter period of time, means as you can see here in the red line, the pH drop is less and for shorter period of time, there will be slight caries activity. If the pH drop is for extended period of time, as you can see in this red line, it is for extended period of time, there will be extreme caries activity. Means if the pH of this dental plaque stays below 5.5 for longer period of time, there will be increased risk of dental caries. Means first there will be initial drop of the pH, then there will be a critical period where the pH falls below 5.5, means there will be demineralization of tooth structure. After that, when the carbohydrate that is utilized by the bacteria gets consumed, the oral environment tries to balance the pH, which will result in increase of the pH. As the pH get increased, there will be a process of remineralization, as you have seen in the demineralization and remineralization cycle, as it is the reversible process. As the pH starts increasing, there will be remineralization of tooth structure. If you like my video, please like, share and subscribe.